So this commenter, in response to my recent video talking about how the overly simplistic chemical imbalance theory of depression does not hold up to scrutiny and research, asks about bipolar disorder. Now, it's a great question, and what's interesting about bipolar disorder is from the get-go, it has been better understood as a more complex, multimodal syndrome. Let me show you what I mean right here. And what you can see here is this is from a 2017 study, and I'll post the link below, of course, where they examined the causes of bipolar disorder. And you can see here that it is a deeply multimodal, multifaceted syndrome that includes things at the cellular level, like the mitochondria or intracellular signaling, specific issues like neurotransmitter activity, but also inflammation, signaling pathways, and more complex interactions throughout the brain. So what you can see there is it's a really multifaceted, multimodal syndrome. And diagnosis is just based on symptoms, specifically mania. If you exhibit mania, you get a diagnosis of bipolar I disorder, even without depression. And if you have hypomania plus depression, then you get a bipolar II diagnosis. Hypomania is not as severe as mania and doesn't usually lead to that sort of heightened state that becomes non-functional. Usually hypomania is actually desirable for most people who experience it. And so we're probably lumping, again, a bunch of different neurotypes into that one bucket based on symptoms, which is likely why the medications help some people more than others. And when we look at the medications, and I'm not going to bore you with the details because they're so complex, but if we look at something like lithium, the myriad of effects it has ultimately lead to an increase in neuroplasticity, meaning an increased ability for the brain to rewire and remap, as well as an increase in circadian rhythm activity being more sort of restored or steady, so improving sleep. And those two functions alone, which is not all lithium does, but it's a huge bulk of it, likely are what are helping with these particular syndromes. And again, we could go into all those details, but I think that would be too much for TikTok. So I'll leave it there for now and really appreciate the question. But if there's anything in there you want me to talk more about, as always, please throw a comment down below and I'm happy to chat about it some more.